Hello everyone. So today's topic is clavicle. So it is a long bone that is supports the shoulder joint. It transmits the weight of the limb to the sternum. Now parts. It has shaft, two ends, medial and lateral. Now side determination. Side determination, the lateral end is flat and the medial end is large and quadrilateral. The shaft is curved. The medial 2/3 is convex forwards and lateral 1/3 is concave forwards. Now coming to the facts, it is the only long bone that is horizontal. It is subcutaneous throughout on its superior surface and it is the first bone to ossify. It ossifies in membrane. There is no medullary cavity. Now features. Now the shaft is divided into a lateral 1/3 and medial 2/3. The lateral 1/3 is flattened from above downwards and it has two borders, the anterior and the posterior border. The anterior border is concave forwards and the posterior border is convex backwards. It has two surfaces, superior and inferior. The superior surface is subcutaneous and the inferior surface has an elevation that is known as conoid tubercle, and towards laterally it extends as a ridge and it known as trapezoid ridge. Now medial 2/3. The medial 2/3 is rounded and it has four surfaces. The anterior, which is convex forward, posterior that is smooth, the superior that is roughed on the medial part, and the inferior that is rough. Towards laterally there is subclavian groove present. Now the ends. Now coming to the lateral end, or it is also known as the acromion end. It is flattened and it bears a facet that articulates with the acromion process of the scapula form the acromioclavicular joint. Now medial end. The medial end is also known as the sternal end and it is quadrilateral and it articulates with the clavicular notch of the manubrium sterni to form the sternoclavicular joint. The articular end extends downwards. The articular end, see, it extends downwards and articulates with the first costal cartilage. Now coming to the attachments, the lateral end, the margin give attachment to the acromioclavicular joint that forms the capsular ligament. The medial end, the margins articular surface for the sternum. Here there is fibrous capsule of sternoclavicular joint, articular disc postero superiorly and interclavicular ligament superiorly. Now attachments in the lateral 1/3. The anterior border gives attachment to deltoid muscle and the posterior border gives attachment to the trapezius muscle. The conoid tubercle and the trapezoid part have the attachment with coracoclavicular ligament. Now medial 2/3 attachments. The anterior surface gives attachment to pectoralis major. Half of the rough surface of the superior surface gives origin to the sternocleidomastoid. The oval impression in the inferior surface gives attachment to costoclavicular ligament. The subclavian groove gives insertion to the subclavius muscle. Margin of the groove gives attachment to the clavipectoral fascia. Now the sternohyoid muscle origins from the posterior surface of the medial head. So this was the clavicle bone. Comment down if you want anything particular from this bone that should be explained in details, like for example the costoclavicular ligament, the clavipectoral fascia. I'll be doing more classes on this. Thank you.